Thank you, Chair. The 18th meeting of states parties to the Mine Ban Treaty is a rather unique gathering of states to review past achievements, progress, challenges, and where appropriate, remark the way forward to the various pillars of the treaty. It is at this critical time that victim assistance be revisited and put to the front of the priority list of the Mine Ban Treaty. It is even more appropriate for states to ensure implementation of all the relevant Oslo Action Plan actions in the content of the new action number 40 regarding emergencies and conflict. The situation of victim assistance has worsened with the current pandemic of COVID-19. Responses to landmine monitor questions on COVID-19 noted that survivors and other persons with disabilities were not able to access services and rights on an equal basis to others during the pandemic in a number of mine-affected countries. This finding is consistent with the United Nations study that found persons with disabilities were at a greater risk of discrimination in accessing health care during the COVID-19 pandemic. Furthermore, about 3/4 of new annual mine casualties were recorded in states parties experiencing armed conflict. Although victim assistance has seen some improvements in implementation by some states, persons injured still lack access to first aid, emergency medical care, and trauma surgery, and survivors in most affected states still lack the necessary support and access to continuing medical care for corrective surgery, rehabilitation, livelihood, and psychological care, which are recognized as victims' rights. Many affected states have struggled in terms of priority, implementation, and funding, and are now facing a much bigger challenge due to the prevailing pandemic of COVID-19. Implementation of victim assistance is now than ever more crucial in these difficult times. We call on donor states to extend the much-needed support towards victim assistance. Survivors need to be spared from going through more psychological trauma by having all states fulfill the vital promise of providing adequate assistance.